How's it going, guys? We have a medium difficulty question for Cardiopulm. 59-year-old dude, 7-month history of intermittent dry cough, gradually progressive, shortness of breath on exertion, daytime fatigue, no past medical history, dry and respiratory crackles are heard on auscultation, blood pressure 120/80, and a high resolution CT of the chest is shown. I'll talk about this as we move through the question. Which of the following additional findings most likely we see in this patient? Choice A, diastolic rumbling murmur is wrong. This can refer to mitral stenosis on USMLE. There's really no such thing as tricuspid stenosis, but mitral stenosis will be described one of two ways. They'll say either a rumbling diastolic murmur, which means low pressure between the atria and ventricles. And in contrast, if they had blowing diastolic murmur, that would be aortic regurgitation. So rumbling is low pressure. The second obvious way is your diastolic murmur with an opening snap. Okay, so opening snap in mid-diastole followed by a decrescendo mid to late diastolic murmur. Mitral stenosis, 99% of the time it's due to history of rheumatic heart disease. So as a kid, you have mitral regurg, and then the valve scars over, becomes mitral stenosis later in life. Mitral stenosis can also be seen in pregnancy. They really like that in USMLE. So by second trimester, when plasma volume expands 50%, then subclinical mitral stenosis can become nascently clinical, where there's new onset shortness of breath and a diastolic murmur in second trimester. Wrong fucking answer. Choice B, Dynein defect is wrong. Obviously, this refers to Cartaginer syndrome, primary ciliary dyskinesia, and this will present with dextrocardia / situs inversus, recurrent respiratory infections since childhood. It'll sound like cystic fibrosis, but they might show you a chest x-ray or CT where the heart is on the right side instead. And they can give you ectopic pregnancy in a female. They'll give you, because of the cilia within the fallopian tubes that don't work. In the male, they'll give you sperm that are present in the sample, but they lack motility because of the Dynein defect, the cilia dysfunction. Whereas in cystic fibrosis, they get CBAVD, congenital bilateral absence of the vas deferens, where there's absent sperm in the sample. Wrong fucking answer. Choice C, mid-systolic murmur loudest, second or costal space, left sternal border, refers to pulmonic stenosis is wrong. Pretty much a non-existent murmur on USMLE outside of the 22q11 DeGeorge / velocardiofacial syndrome scenarios. Okay, so if you have DeGeorge, obviously you get a more robust constellation, broader constellation, cleft lip palate, hypocalcemia, where you get agenesis of the third and fourth pharyngeal pouches with lack of parathyroid development as well as thymic development, so T cell dysfunction. Velocardiofacial syndrome, they can just give you someone who, let's say, kid has a cleft lip palate and maybe has a heart defect like truncus arteriosus or tetralogy of Fallot, and that's where you get the pulmonic stenosis, part of tetralogy of Fallot. And they might not give you any other findings. Nothing about calcium, nothing about T cell dysfunction. That could be velocardiofacial syndrome. So it's a spectrum of severities. But tetralogy of Fallot, your pulmonic stenosis, your right ventricular hypertrophy, overriding aorta, ventricular septal defect, wrong fucking answer. Choice D, normal PCWP, correct answer. Diagnosis is idiopathic pulmonary fibrosis, aka interstitial lung disease, aka usual interstitial pneumonitis, UIP, which NBME tests. And if you've been following my content or going through my playlists, you'll know I've talked about this in prior clips. So it's going to be UIP is going to be the answer in USMLE, where they give you a patient over the age of 50 who has an idiopathic 1 to 6+ month history of dry cough, and they can give you dry and respiratory crackles. And we will generally have a left heart pathology that we can rule out. So we don't give you elevated blood pressure here, okay? Because you can say, well, hypertension could cause left heart dysfunction, which backs up onto the lungs, etc. More of a congestive sequence, which we don't have. Okay, dry and respiratory crackles, also very buzzy, as per my observation across NBMEs for idiopathic pulmonary fibrosis, a Velcro-like oscillatory finding. So UIP, and because it's restrictive lung disease, you have a normal / increased FEV1 and FVC, and they want prednisone or pirfenidone, the latter being a fibrolytic agent. Those can be treatments on NBME exams for UIP. And the honeycombing is what we're looking at in the CT here. So reticular / reticulonodular patterning, very buzzy, they'll say in vignettes. That refers to honeycombing. That's idiopathic pulmonary fibrosis. So and it's Buzzy CT that I jacked off Wikipedia. So let's just, and the elephant in the room, you say, well, I don't know what PCWP is. Okay, let's go back to kindergarten for a second. So PCWP equals left atrial pressure. So it just, if PCWP is high, it means you have left heart pathology. If PCWP is normal, it means that your left heart is not involved. Okay, so this starts with the lungs, has nothing to do with the left heart. So this can cause cor pulmonale, where you get right heart dysfunction secondary to the pulmonary cause. Okay, but PCVP is preserved. Choice C, senescent calcification bicuspid valve, aortic stenosis is wrong. Okay, that could be mid-systolic murmur, generally at the second intercostal space, right sternal border. Highest yield point I can tell you about tricuspid, fuck am I saying? About aortic stenosis. First of all, it need not be Turner syndrome bicuspid aortic valve. The second point is that it absolutely does not have to be adults. Okay, students get this wrong all the time. There's plenty of NBME questions, especially 2CK step 3 level, where they'll happily give you aortic stenosis in a 3-month-old, in a high schooler. And students are confused because they think that it has to be symptomatic in adulthood. Absolutely not. Okay, so autosomal dominant bicuspid aortic valve, most common cause, USMLE will happily give it to you in pediatrics. So whoever taught that it's only in adulthood, they're fucking wrong and they're fucking stupid. Wrong fucking answer.